Thank you so much, Sandria, and thank you. Actually, Waleed is my brother from another mother, and we've had such an amazing time together in the last 15 years. Just winning and losing elections, setting up the society together, working together on the foundation, and doing so many things to better the lives of patients. And it's been an amazing journey. Thanks for your kind words and for embarrassing me, but. It was great to hear from you. But welcome, my friends, my family, my HBMC family, patients who are my family as well. So today it's actually about a book which was a dream to me, a dream which would be focusing on what patients need to know. Patients want to know from us about diet, about exercise. They have so many questions. And today in this room, we have amazing rheumatologists, my friends, my tribe here, my sisters in rheumatology, my brothers. We have also gastroenterologists, the amazing people here, the top ones, the ophthalmologists. We have so many specialists from across the field. And what do? We use state-of-the-art medicine, costs millions of dollars to develop. We're such experts in outcome measures. We're such experts in adverse events, and we discuss this ad nauseum. But when our patients ask us, what do I eat? The truth is we've had very little training in medical school in diet and nutrition. Patients seem to figure it out on their own. They work with alternative medical specialists, they work with dietitians, nutritionists, and they somehow try to figure it out. But, the evidence, we believe in evidence-based medicine, and the evidence is mounting. The evidence is mounting for the role of the gut microbiome in health and disease, for autoimmune diseases, we all know. Even for psychiatric conditions, for instance, the gut microbiome is one of the biggest producers of serotonin. It comes from your gut. Your mood is influenced directly by what you eat. Your autoimmune diseases, heart disease, everything is related to those bacteria which live with us. So diet definitely influences that, and we'll be hearing more about it later. Exercise, of course, releases all those good endorphins, strengthens your muscles, helps your cardiovascular health, and there's so much to learn. It's just not possible in our clinic visits to do this, and hence my dream was that I should write this book to help patients get better ideas about this. So I started writing it, and I met Melanie Swan. Melanie is, I think, not here today, but Melanie was a writer with the national newspaper. She was also a yoga specialist, and she shared a common passion with me because both of our mothers suffered from debilitating rheumatoid arthritis. So we decided to, spruce up what I'm writing. She helped me edit. She wrote some of the chapters. The pictures of yoga in the book are of her. And then she introduced me to the wonderful Victoria Tipper, who is an amazing nutritionist. Everyone who's been involved with the Middle East Arthritis Foundation would have heard Victoria's talks. Victoria speaks about the gut microbiome and how your health is influenced by a myriad of things. And the whole middle section of the book, which refers to nutrition, is written by her. And we went from there. We got in Hened Chiori, another amazing lady. You'll see her up here today. And she is not just a physiotherapist, but she integrates Pilates and body work and strengthening into her whole practice. And she's also been responsible for writing chapters in the book. And finally, on this journey, as we meet people and we learn from each other, I learned from patients. And one of my patients, who's not here today, Rashmi Krishnan, she had to return to India, suffered a lot with chronic pain. But she helped me edit the book and told me what we should do from a patient perspective. What do patients want to know? I was writing from a doctor's perspective, imagining what the patient wants to know, but she was actually a patient. And she spruced up the book, and she included patient experiences at the end of the book and talked about how we can be positive. So just talking to her, she helped a lot, and she's one of the co-writers, but we learn so much from our patients if we would only listen to them. And there was this amazing lady, a Jordanian woman, who about 12 years ago, I was working in Albira Clinic, and she was on every biological, every latest treatment costing thousands of dollars per month, and she would be okay for a week and then flare again. So she took it upon herself to educate me. She would come in with a flare and say, "Doctor, yesterday I ate a roll of bread. Look at my joints today. Doctor, yesterday I had cheese. Look at my joint today." So she really took me through this process, and I would read then the evidence behind this. What are the published data? What do we see in this? And through this process, reading about it, wrote a few papers, and then came to this interest of bringing it out in a book. Now, besides that, of course, we're so grateful to all our patients, and we all learn from you. You inspire us every day with your strength, your fortitude in the sight of this illness, which can be very painful, very debilitating. Sometimes you can't get out of bed. Sometimes you feel so, despondent, but you inspire us and help us go on as well. I wanted, of course, I already mentioned my friends who are here, my rock, my supporters. Thank you for being here. And I wanted to mention that our rheumatology family, we are a family. We do everything together. They've been so instrumental in encouraging this book. Lots of doctors just want to rely on medication, on evidence-based, but they've been so open to this whole idea of the book, promoting it to their patients and recommending it. And I'm so grateful for all of you for being here today. Thank you. And, I think they are a big backbone of support for all of us. And my wonderful HBMC family, we are 10 years with Humeira Badsha Medical Center. They all believe in me, in the cause of patient support and patient care as passionately as I do. And finally, of course, I have to mention my family. My mom, of course, everyone knows, is my inspiration. My dad taught me so much. My sons, my family is not here today, but they are with us in spirit. And what else did I have to say? But of course, none of this would have been possible without the Middle East Arthritis Foundation. Mr. Mohammed Al-Hashimi, who has been so instrumental, not only as a prominent Emirati figure, but as someone who did not feel shy to speak about his illness, to encourage others to seek help, and to put himself out there and to make this. So we're so grateful to you for doing that, despite your positions in the government and other places where it might have been of embarrassment, but you did not. And that actually changes how other patients view themselves as well. And of course, Suzanne Al-Houbi, who's been the founder also with all of us for the Middle East Arthritis Foundation. She's so inspiring. She's the first Arab woman to climb Mount Everest and the first Arab woman to summit all the highest peaks on every continent. So they're here with us today. Welcome, everybody. I hope you read the book. At the end of this evening, you can pick up a copy or as many copies as you like. Give it to people and recommend them. And we will be hearing now from the other authors. So thank you. Thank you for being here.